Okay. So first thing I'm gonna do is check my orders. I have an order for Valerie Jones. I have an order for Valerie Jones, no known allergies, and I need to insert an NG tube and connect to intermittent low wall suction, and flush it with 50 milliliters of water every 8 hours and as needed. So I'm gonna gather my supplies, go in the room, and I knock. Hey, my name's Kelly. I'm gonna be your nurse today. Can you tell me your name and date of birth? She tells me Valerie Jones, 11/9/81, and that is correct. You have any allergies? She told me no. Have you ever had a feeding tube before? And she told me no. Okay. So, okay, I'm gonna ask about her nutritional status and bowel habits. And the first thing I'm going to do is do a focused GI assessment.
We're checking for grimacing on her face, rebound tenderness, knee acids. I did have a first. She didn't have a tender spot. I would tolerate that last. So
Okay, I'm going to wash my hands, put on gloves.
now I'm going to set her back up, bench off the line. Open it up. Breathe full. I'm gonna check. You can see it removed.
Okay, I'm going to look at her abdomen. I'm looking for stretch marks, scars, pulsations, anything like that. She doesn't have any. I'm going to listen for bowel sounds in all 4 quadrants. And they are present. If they weren't, I would listen for 5 minutes in each quadrant, and I'm going to listen in the epigastric area for a bruit, and it's present, so that's good. I'm going to set the patient in high Fowler's position.
Okay, so open up my tube. I'm opening up my. I would put sterile water in here.
And she's got a pillow behind her head. So I'm going to look in her nose. Breathe in for me. Breathe in for me. Check her gag reflex. And she's good.
I would.
Okay, so I'm going to open my passages. I'm going to fill this with water, date, time, and initial that.
Okay, I'm gonna keep it. I'm gonna drape her.
And the first thing I'm going to do is measure.
You give her a cup of water. Okay, Ms. Jones, I'm gonna have you to put your chin to your chest. So there is a drill that. I'm gonna start inserting.
So I'm going to measure from the tip of her nose to her earlobe, and then from the earlobe to the xiphoid process and mark it.
This is swallow, clean the top of it before I open it. Swallow, swallow, swallow. I'm gonna open, swallow, tube feed, swallow, swallow.
Okay. I'm going to load the end of this and spray it up her nose.
Open it.
And give her this cup of water and tell her to swallow as I'm inserting it. Okay, you're ready, Ms. Jones?
We're gonna make sure the patient's not grimacing or getting pain.
Swallow, 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 swallow. If I was to meet resistance or she started excessively coughing, I would pause.
Now I'm going to listen to her lung sounds. Lung sounds are good. Now I'm going to call for an X-ray from the replacement. It's okay. It's confirmed. So everything's good. Now I'm going to flush with 15 mL of water. to flush 50 milliliters of water through the tube, make sure it's not clogged, it stays safe and flushed. So now, I'm gonna hook it up to low wall suction.
Very good, Ms. Jones. Not having any pain, discomfort? She says no.
Alright,
Okay.
so I left it up.
She didn't need anything else.
So, I'm gonna look in the back of her
I
throat.
now have an order to discontinue the suction.
I see the tube. I'm gonna listen to her breath
So,
sounds.
I'm going to, take out.
Looking at my meds, right, Ms. Jones, let me know if you got a little bit.
Suctioning.
Check on you.
I'll let the rest of it in the tube.
And there I can see her, so that's good. I'm gonna call for x-ray.
Documents that I put.
X-ray came, everything is good, so I'm gonna flush this
Now I'm going to take out the.
with 50 milliliters of water.
I'll also mark the NG tube with a marker, so that way I would know.
And hook to intermittent low wall suction.
So now, I'm going to undo the pin. Take off. Okay, Ms. Jones, I'm gonna take the NG tube out, okay? So I'm gonna take it out in a split motion. I'm gonna wrap it up and
Okay,
put it in a box.
so that's on, that's good. So, now I have orders to discharge
Ask
my
Ms. Jones if she needs anything.
So, I'm gonna unhook this, let all of that run down there before I turn it off. Turn it off, measure the output.
Did you give me smalls?
Okay, Miss Jones, we're gonna take this tube out.
Wash hands.
I'm also gonna educate her, she's supposed to say MPO and elevate the head 30 degrees all times. Okay, you ready? 1, 2, 3.
Feeding.
I'm gonna wrap her in a glove,
Going to.
put it in a biohazard bag, throw it away,
Valerie Jones, I was just here for a
clean up.
No known allergies to resistant stones. I'm supposed to give 1 can of Jody, 1.5 every.
Do you
4
need
hours.
anything? She
Okay,
told me
two.
no.
Flush with 50 mL of
No,
water.
lower her.
So, also I've ordered check gastric residuals every 4 hours, cold feeding. and
Hand
no
hygiene,
position.
and then document how she tolerated it, her output, stuff like
Now,
that.
I'm already in the room.
Okay, G2.
I said,
Okay. So I've already identified my patient, this is Valerie Jones. I have an order here to give 1 can Jevity every 4 hours per G-tube, flush with 50 milliliters of water after each bolus feeding. And check residuals every 4 hours, hold feeding, and notify physician if it's over 150 milliliters. So I'm gonna get some gloves.
checking her tube, checking for signs of infection, make sure it's intact, make sure her skin intact. I see no signs of infection. Her dressing was good, everything looks good. So, once we've done that, I'm gonna set her back up.
Just pull that out.
The bed needs to be at least 30 degrees for respiration. So,
The first thing I'm gonna do is check her insertion site for signs of infection,
get this out,
swelling,
pull it up,
redness, gonna check the dressing,
get this over here.
everything looks good.
This, okay. First thing.
Alright, Ms. Jones, we're gonna give you a feeding.
Check her residual.
I'm gonna fill this with water, date, time, and initial it.
Take this, unclench it.
And the first thing I'm gonna do is check my residuals. So I'm gonna unclamp this.
Clamp. Insert. Clamp this back.
Clamp it back.
She has 100 of residuals, so it's not over 50, so I don't.
And I'm gonna measure it. It's only 100 milliliters, so I can
check
still get
the-
the feeding. If not, if it was over 150, I would
It's acidic like it should be, so I'm good to give.
notify the physician. And then I'm gonna check the
Now I'm gonna put
pH.
the residual back.
It's acidic like it's supposed to be, so that's good.
Unclamp.
And I'm gonna put the residual back.
Clamp back.
Unclamp.
Put it in. Back. So, looks good. Good.
Clamp this back.
Normally I would flush with 50 mL of water, but since we're giving Jody, you don't need to flush.
I'm gonna check my
So, now
formula here, it's not expired, we have the right one, everything is good to go. I'm gonna clean the top off with an alcohol swab and open it.
Clean off with an alcohol swab. Open, I'm gonna take full syringe off.
I'm gonna elevate her till it's 30 degrees.
So now I've cleaned off my top and I'm gonna insert. I would ask Ms. Jones how she's feeling urine for the feeding. I would move it up or down based on.
I'm gonna unclamp this
If everything's gonna be.
and slowly pour this in here. I'm gonna watch for, see if she's in pain, ask her if she's cramping. If she was, I could lower it and put it in slower.
I need to.
So that's all in. I'm gonna clamp it off.
50. Unclamp,
Okay, now I'm gonna flush it with 50 milliliters of water.
clamp it back. Ask her how she's feeling.
Unclamp,
She needs
flush.
anything. Now I'm
Clamp
gonna
back
clamp
up.
up. And I'm going to cover her back up.
I'm gonna cover her back up, ask her if she's doing okay. She says yes. Do you need anything? She tells me no.
Tell her that she has to be at least 30 degrees.
I'm gonna wash my hands, lower the bed, give her a
Hands,
call light,
report cord, and now I'm gonna go
Um,
off all my supplies again.
and go document. Clean.